Diagnosis is a detective effort. You're constantly curious. It's important to leave no stone unturned.
This one is just blown.
And did it bleed at all?
I don't know. I can't even touch it.
We meet a number of patients who we have to explain results to. And if someone has got anxiety, there are different methods we would try to do to break the news.
What do you understand so far?
All we've heard is autoimmune, we've had possibles like maybe some form of cancer, we've heard all kinds of crazy stuff going on.
We believe about half of all men between the age of 40 to 70 will suffer with some degree of erectile dysfunction.
I see an improvement. I see a massive improvement. I don't think he does.
No. And when you say dizzy, what's happening?
Just going around.
Room spinning around?
Yeah, anything up to a quarter of an hour.
So I'm a bit concerned about it, really, so what should be happening? It sounds like quite a severe symptom.
Hello. You've been in the wars, have you? Literally. Right, so what happened?
I went inside this park. I was trying to jump over the fence when we were going out. So my foot got stuck in it.
Yep.
And I fell down on the hard floor. And I
Whacked your eye. Straight on like that, yes?
Straight on. She
Oh, dear. Okay.
this injury over here, and it was quite swollen at that time.
Yeah.
But
When did it happen?
On Sunday.
On Sunday, okay.
Yeah. At the moment, it has gone all over her eye.
Yeah.
So
You can be hit over here, and you can still end up with a black eye. It's almost as if with all the tissue in the scalp and around the eyes, when it bleeds underneath the skin, which is what a bruise is, it's very vascular, so you get lots of bleeding, and it can track down through the tissue planes and will end up around here. So it's really common to get this, even though the hit was up here, often it will come down here. Now, what I need to do is just make sure there's no deformities of the bones. You're very brave. Okay, there's none of that. What I want you to do, okay, is look at my finger and just move your eyes to follow the finger. Can you do that for me? And what I want you to do is tell me if you get any double vision, okay? So head nice and still, ready, follow. Okay? Only one finger?
Yeah.
Good. She's going to be fine. Okay. So there's no deformity of any of the orbit, okay? What we check for then is just in case sometimes you get a little crack inside the orbit and the muscles that control the eye can get stuck a bit, okay? So if that happens, then the eye doesn't move as well on one side, so you end up getting double vision.
Right.
I'm happy she's not.
Okay, so she doesn't have...
Yeah, so I'd keep an eye on it, just see how that goes. You would expect this to slowly get better over the next 7 to 10 days, okay? So it will change colour, it will turn into a sort of a deeper, then it'll go sort of a brownish colour, then it will fade away as the body absorbs that sort of blood back into it. But it may even look a little bit worse tomorrow. Right. Next time, don't jump over that fence. Okay?
Thank you very much.
Bye-bye.
Bye.
Hiya.
Hello, I wonder about getting an appointment to see the doctor.
A routine appointment, or is it something urgent?
Well, what it is I've just come away from the hospital. I went for an assessment for an operation on Tuesday, and I can't do it because my blood pressure's way too high.
Okay.
So they've given me a letter to give to the GP and get on medication straight away.
Okay.
I have cancer, and obviously I want to get the surgery done
Quickly, okay. I'll go and speak to a doctor and see if we can fit you in on the emergency list. Okay? Yeah.
Come in.
I'm going to scream.
That's all right. How you doing? All right?
Good. Why don't you and me get married? I'm out there so often, don't I?
Oh, dear. Right, blood test.
Okay.
I've had so many, I'm sure that not getting the right things, right.
No, it's fine. They're all different sorts, aren't they?
Are they?
Yeah, different ones that we're doing for you. There you are. Right.
If you hurt me, I will play out.
Oh, be on your best behaviour now. Nice straight arm like that.
Okay, lollipop.
I haven't got, look, I've got badges. I'll give you a sticker.
They always give something away, didn't they, to please the kids?
Children, not grown-ups still.
Shut up, Scratch.
But we never grow up.
Oh, look.
I feel as if my life is now ebbing away down your jar.
Oh, gosh, you listen to it.
Oh, most men are really squeamish, aren't they?
Yeah, it's really bad, really, but then there you go.
Oh, I don't have a baby.
It's not that bad.
Are you sure? Have you had some?
Yeah.
How many?
One. One.
Thank you very much.
What's that, sorry? This is a BNP, which I believe it shows the level, well, to see if your heart's enlarged or not. Yeah, so is this to do with shortness of breath?
I've got a big heart.
Oh, I
Believe
bet.
me, I've got a really big heart. Would that show up if I've had a couple of beers today, a couple of drinks today? It won't. Oh my God, look at that. She's had a go at me on the way down here.
Have you? I bet.
I thought, oh God, I've got to go to the doctors again. I had a beer, I had another beer, went into the greenhouse, I sat there, doing my plants, and I thought, this is lovely.
I'll have another one.
And then she arrived and she went, you haven't been drinking, have you?
Yeah, I bet, yeah. No, it's hot chocolate weather, not beer weather.
So
right.
that's it.
That's it. All done, okay?
Thank you very much.
All right, nice to see you.
And you have a nice day.
And you. Bye-bye.
The anaesthetist found my blood pressure was so high that he said he didn't risk and I needed to come to you straight
Oh, really?
away and
Okay.
get medicated.
Yeah, sure, let's have a look. So,
there's the letter.
what's the operation you were having?
Well, this one is only a bowel investigation. I've had 4 liver biopsies.
Yeah.
I've got 1 more liver biopsy tomorrow.
Mm.
But my bloods are showing very high for cancer again. I've had breast cancer, I've had node cancer, and I've had bowel cancer.
Yeah.
So they want to do, what is it, when they put the camera inside?
Mm.
And they want to do it while I'm out. And they're assuming probably that I've got cancer in the bowel again.
Okay.
So, yeah.
Ah, nice to see you. Just take a seat. Just over there. No, that's my chair. We know people who drink wine have fewer heart attacks than people who are teetotal. Say, oh, say off. Oh, that's good. Yeah, good. I mean, we could do a T4, but I think you have more important for fish to fry. How can I help?
The last 5 weeks, I think it is,
Yeah.
I've had ear infections.
Both sides?
Yeah, this one is just blown. I can't even touch it.
When did
Can't
it do
see.
that? Yeah.
Yesterday.
Okay. And did it bleed at all?
I don't know.
Mhm.
I can't even touch it.
Is there anything coming out of it?
I've been putting
Drops of some kind?
cod liver oil in it.
Olive oil.
Yeah, yeah.
Yeah.
Cod liver oil.
Yeah.
Yeah.
Are you a cigarette smoker?
Yeah.
Okay. Can I examine the ear?
If you can.
Right.
It's going to kill me.
No, I don't want to kill. I don't want to kill you. On the other hand, I can help you best if I get examining it. Yeah. Have you been on any antibiotics for it at all?
In the last 4 weeks, yeah.
My, oh, it's really inflamed. Do you get eczema?
No.
No.
Never
Just turn around to the other side. How's this ear?
This is the one I was supposed to have had syringed today, and I said I couldn't do it.
Yeah, I'm sure you find it'd be difficult to bear it. Just have a look. But it's nice. It's much clearer and much less swollen than the other one.
Yeah.
I'm sure it's still so. Do you put cotton buds into your ears?
Only now and again when I clean them.
So before all this started, how many cigarettes you used to smoke?
About 5.
5, okay. Yeah.
I'm not a heavy smoker anyway.
Yeah, just open wide your mouth.
I can't, it hurts.
Okay, as hard as you can. Sorry, Matt. Say, oh, good, well done. That's good. Nicotine predisposes to ears, nose and throat infections. Are you on any painkillers for this?
They give me antibiotics and that was it.
Okay, and
The strongest ones you got, I can take.
I can imagine, yeah, absolutely, yeah. Okay, so either of these antibiotics might make you feel nauseated or vomiting. If they do, take one of the anti-nausea tablets. I apologise for the nausea or vomiting in advance, but there's no other substitute for this one that can make you a bit sick. I'm sure you do, but these tablets will make it better. And it's only about a third of people who get nausea on this second one. But you need both, okay? Because this could turn out to be quite serious if you don't take both. I'm giving you a strong painkiller. I want you to take 2-4 times a day.
Okay.
Good.
Lovely, thank you
Good.
very much.
All the best. Hopefully
Thanks.
that'll help. Try and drink as much water as you can. I know you won't feel like it, but fluids are really important.
Yeah. I feel sick just drinking. I've been sipping water.
Yeah.
But it just makes me feel sick.
I know, but you'll be feeling more nauseated if there's nothing in your stomach. If it's empty. So try and manage your best, okay?
Lovely, thank you very much.
Yeah. All the best.
Thanks.
You're welcome. Bye.
So these readings are very high.
Yes.
Do you smoke at the moment?
Mm-hmm.
Yeah. How much?
About 20 a day.
Okay.
I'd say roughly about 20 a day.
Okay. Ever thought of quitting?
I've been here once or twice.
Okay. So, I mean, on the basis of this, we definitely need to start a medication.
I hope so, because otherwise I won't be able to have surgery.
Yeah. Miss Smith had a background of bowel and breast cancer in the past, and she was being planned for an investigation called a colonoscopy to see if there was any evidence of any recurrence of her cancer. She had her blood pressure taken at the hospital that morning, and unfortunately it was very high. And so she was advised to come and see the GP by the anaesthetist to see if potentially she could be started on some medication to help improve it. There's a tablet that we call a sort of a water tablet. I don't know if you've heard of these types of tablets before.
What is it, water? You mean that you'll urinate more? Because I urinate way too many times.
So that can be a side effect. The other tablet is something called amlodipine, which is a different type of tablet. It works in a different way. And the main side effect of that one is that it can sometimes cause your ankles to swell, but not always.
Ankles?
Yeah.
Okay.
So perhaps we could try that one? Yeah? We'd obviously have to bring you back to have that checked again.
Yeah.
Just to see how things are going in about a week's time, say.
Okay, so make an appointment for a week.
Yeah, would that sound okay?
Yeah, that's
Given how high your blood pressure was today, there is every chance that you might need to either increase this or even at a later point give you a second medication for blood pressure, potentially, just to kind of let you know that's how things normally go.
Yeah.
But you might be fine on this tablet, and that may be all you need.
Okay, thank
All right.
you so much.
Take care.
Bye-bye.
Bye-bye.
Come through. Hi, come and take a seat.
Thank you. I just have an appointment for checkup. I think I just get this one.
How old is Anthony?
How old he is? He is 5 now.
5 months old.
Yeah.
So why didn't you come for the 8-week check?
I don't know, because we was be in Poland, then...
Did you have it there?
No, darling, no. Injection.
Has he had any of his injections?
No, darling,
None?
No.
Okay, Agnes, it's very important. The system in this country, it's very, very important that the babies don't miss the immunizations, okay?
All right, okay.
So we don't like people to start traveling around when otherwise they miss all those things that they need happening.
All right.
So at 8 weeks, we had to check the hips, the heart and the eyes. Very important for us to do that, okay? The immune cells that mother gives to the baby by the placenta, they start to produce as the baby's getting older. And it's really, really important that we start those vaccinations from the age of 8 weeks. There are incidences where babies do slip through the net, unfortunately, especially in Slough, as we have a multi-diverse population. Travel is very common, and therefore appointments can get missed. Is his weight increasing? His weight, has it gone up?
Oh, he's grown up?
Yeah.
He's absolutely fine. My mother, he said he's looked like 1 year.
Lovely.
Yes,
Does anyone smoke in the house?
Yes, we're smoking. No, in the house, never. outside.
So you and Dad both smoke?
No, only I'm smoking.
Okay.
He's not smoking.
Okay. Have you been going to the health visitor?
No, I didn't.
To the clinics?
No.
Try to go to the health visitor clinics. They're really good. They'll give you advice about feeding, which food you should
Do
start.
I have to go? Oh.
It's better to go.
But I have a second child.
I know, but we need to check the weights.
I don't think so. I will have a time for that. But
Why is that? Are you working?
No, actually, Jacob is just going to school, and I'm just care about with.
No.
my
If you
husband's
ring
father.
them, they can come to your house.
Oh,
Okay.
okay,
We
fine.
need to start getting weights. We need to get weights done for him as
Okay,
well.
yeah,
Okay.
okay, fine.
Lovely.
Ira Hasnin, please. Hello. Right then, come and have a seat. So, Ira, you're getting a big girl now, aren't you? Yeah? Do you go to a nursery or to preschool?
To school.
You go to school?
You go nursery school, don't you?
Yeah. Do you like that? Yeah. Is it lots of fun?
Yeah, we've got a fun day later on today. Fun day.
Oh, wow. So, because you're a big girl now and you're going to nursery, I've got to give you 2 little injections. And do you know why you have to have injections?
I'm brave.
Because you're brave, yes. And because if you get your injections now, then hopefully you won't get sick when you go to big school, will you? And you don't want to get sick when you go to big school because you'll miss out on everything.
All the fun.
Yeah. Okay, so just 2 little injections and then I might have I was brave for the nurse stickers. Yeah, so we'll have a look at those in a minute.
The lion one.
Your lions are very brave, aren't they? Right, you sit on Mummy's lap
So
then.
my lap then, Ira. So we have this done and then later on we go to the fun day at nursery.
Yeah. That's it, good girl. All right, okay, you look at Mummy. That's
Look at
it.
me.
A little pinch. Good girl, little sting. Good girl, well done.
It's
Well
okay.
Well done.
Oh,
Good girl.
that's okay.
Do you want a sticker? Do you want a sticker now?
Do you
And
want
then
another-
and then.
Which one did you want? Where's your lion?
Oh, lion. There he is. There,
There
bravery
it is.
sticker.
Oh, wow, you're so clever. Look, so clever and brave. Here we go, 1 lion, and then maybe you might get another one.
Yeah.
Good girl. Good girl. Wow, you're so clever. Well done.
Good girl. One more little pinch. Good girl. Little sting.
Finished. That's it.
Oh, finished. All done.
All done. All done. All
All
done.
done.
Oh,
Good
sorry,
girl. Well
darling.
done.
Wow. Well done, Ira. Let's go home and then we go to our fun day, yeah? Shall we go to our fun day? Did you want another sticker?
We've got a pink
That's
elephant.
so nice.
And we've got a koala bear. No. Are you happy with your lion? Or do you want one for later, maybe?
I'm going to tell all the teachers.
Yeah? You can go and enjoy yourself now.
Yeah.
Yeah? No more injections.
You were so brave. All the children have to be brave, like you. Yeah, you can tell them you were so brave.
Yeah.
Yeah?
Nobody ever wants to speak to me after I've given them injections. All right then, take care. Bye-bye.
Thanks very much. Bye-bye.
Hello.
Scholastic.
So we just check the feet. Lovely. Just want to check his ears. Lovely. I'm just going to check his hips as well. That's lovely. You can get him ready now. Yeah, there's nothing abnormal. His eyes, heart, and hips all seem fine. There's no birthmarks, and there's nothing in the mouth like a tongue tie or anything like that.
Yeah, I know.
So that's all good. Pop back outside and see the nurse for his immunizations, okay, vaccinations.
Okay.
And then from now on, just record it in here and ask the reception for the health visitors numbers.
Oh, okay.
So I'll come with you.
Okay, fine.
Yeah,
Okay.
let's pop outside and we'll have a check now.
Please, thank you. Oh, sorry.
Come through. Oh,
Sorry, thank you.
come through.
Okay, take a seat in the waiting room.
Thanks.
Can I help you?
Hello, I'm in here today. Come in, have a seat. How are you?
still getting the dizzy turns, but not quite as often.
Okay. So you've had quite a few, you had some falls when I saw you last time.
Yeah.
What's happened in the 2 weeks since then?
I've had one where I come really dizzy, but I've caught myself, but I haven't landed on the floor.
Right. Okay, and that's it, just the one?
Yeah.
So what happened, can you remember what happened that time? When was it, for starters?
It was was on the Sunday.
Sunday just gone?
Yeah.
And what time of day was it?
First thing.
First, what, straight out of bed, or?
Yeah, but maybe it was slightly quick because I have been sort of sitting on the bed for about 5 minutes before I get up.
Right.
Because of coming over dizzy, sort of taking things much more slowly.
Okay. And when you say dizzy, what's happening?
The room's just going round.
The room's spinning around?
Yeah.
Okay, and how long does that last for?
It can last anything up to a quarter of an hour, and then it'll
Settle down.
Settle down.
Right. Okay. And on that occasion, but on Sunday, you think you got out of bed too quickly?
Well, I did sit there for a couple of minutes, but maybe it just wasn't long enough.
Okay. And then you stood up and you just wobbled and you caught yourself?
Yeah.
Is that right? Does the room spin every morning when you get up out of bed?
No,
That was an unusual.
it's intermittent.
Intermittent. Okay. Is that the last time you can remember it happening?
Yeah.
Is that the only time it's happened since I last saw you?
But yeah, because as I said, I've been really sitting down for a long time before I get up.
Right. Okay. And how do you feel in yourself?
A little bit better.
Okay. What do you think's been causing this?
I'm not sure.
Right, okay. It's interesting, it's only happened once in the last 2 weeks.
Yeah.
But it happened 3 times, hadn't it, the week before?
Yeah.
Yeah. Have you had the recording of the heart?
Yeah, I had an ECG.
Right, okay.
And the blood test.
Okay. Blood tests are all fine.
Yeah.
I can't see the recording of the heart, so I need to check that out. So I'm a bit concerned about it, really, so what should be happening? It sounds like quite a severe symptom.
Yeah.
And I think that we should actually get you checked out and see what's going on.
So is he smiling?
He is.
Yes, not at the moment, of course.
But yeah, he is.
He does smile.
How are you? Yes, you're a very friendly chap. Yes, you are.
She's tiny, isn't she? Little dot. That's a good girl. Oh, she's taking it well.
Hiya, man. Tummy feels lovely, soft.
Enjoying that little massage there?
You don't normally get this on the NHS.
No.
That's a lovely smile there, young man.
What does that mean?
How can I help?
One concern is he's getting pale
Okay.
and he's eating a lot of paper. Paper, tissue paper, books, newspaper.
As in he's putting it in his mouth?
No, eating and swallowing. Like he just chew and take inside.
Right, okay.
And he's getting pale and his eyes are getting like puffy from last 2 weeks. Before that, it was not like that.
Okay. And the swelling is just in the face?
Face, yes,
Okay.
puffy eyes.
Okay. And so what sort of things were you hoping for? What sort of things do you think we could do?
Like my sister is doctor as well. She's in Germany. So she said you better consult with a doctor for the thyroid and the kidney tests.
Okay. So what I'll do today is just give him a general check over.
Yes,
All right.
I just want
and then
to
we can
just suggest him a blood test.
Yeah, and then we can do that.
I like that. Look, his whole body is very.
And that's not his normal colour.
Look.
Yeah.
You can see his feet's a bit yellow. Yes. Okay.
Oh, it's all right. I think one thing we can do is do a blood test to check if he's anemic, to check like the kidneys, as you mentioned. We can also include the thyroid blood test in that, and also the vitamin D. All right. I mean, the issue with the paper, I think it's likely that it's probably a phase that he's young and that kids put stuff in their mouth. Let's do the blood test. They normally take about a week to come back.
If there is something fishy, so they will call you.
Yes,
right,
so
same day.
I will keep an eye out for the results anyway myself, and we'll let you know and bring you into the
I will
appointment.
keep in mind. So
All right.
definitely in the morning I will
Yeah.
go there. Thank you,
All right.
Dr. Taylor. Thank you.
No problem. Take care.
Bye.
And I think it should be the heart specialist, because it sounds like a heart thing.
Yeah.
Although the women's been around because you're feeling faint and falling, than it being a balance thing in the ears.
Yeah.
Is that okay?
Yeah.
Can we weigh you?
Yeah.
Sharon came to see me because she has the symptom that she described as dizziness. Her background problem that she has diabetes, but Sharon has a particularly severe form of type 1 diabetes. She also has quite an unusual condition in that she has too many platelets, which are the little bits of the blood that help you to clot if you have a cut. And she's on treatment for that. And in the past, she has had a very severe form of depression that required her to be hospitalised for a short period of time. That was called psychotic depression. That was 9 years ago now, and she's completely recovered from that and had no further symptoms. When you have this dizziness, are you aware of your heart beating quickly or missing a beat, or...?
I do get sweaty. I don't know if that might be a sign that it is.
Right, OK. Let me have a quick listen to your heart and your lungs today, can I? Listen down here. Yeah, someone's the heart murmur. I'm not saying it is, but we need to get that checked out as being part of this. So, I'll write the heart box and I can see you again, see if we can find out what's happening with this.
OK.
OK? In the meantime, I don't know what else you can do, really, other than exactly as you are doing. When you get out of bed, sit down and don't rush out of bed. When you stand up, it's quite a complex thing for your heart and your cardiovascular system to maintain the blood flow to your head. It's gone from lying down to standing up. It's still got to get the blood to your head.
Yeah.
So it has to take some adjustments. And I think for you, it might be taking a bit longer because of all your other medical conditions.
Yeah.
And therefore, if you stand up too quickly, the blood doesn't get to your head and you fall down. OK. Thanks for coming in.
OK, just bear with me one moment. Let's find you. Friday the 15th. Oh, that's my writing.
Lovely to see you.
Thank you. I'll come and see you in a bit.
Yeah, all right.
Fill you in.
Logan Reed. Are you Logan? This is Hussein, who's sitting in with me today. He's a student. So Logan tells me that he's just had ulcers on his side of his tongue since yesterday.
Yes.
Okay.
He's recently just moved up to the 8 mils of Tiflotol.
Yeah.
So we were told to look out for things like that.
Yeah, absolutely, yeah. Good, we'll have a look. When did he move up the dose?
He's been on 8 milligrams since Tuesday.
Okay, right, okay. How's he doing in himself on the Tegretol?
Yeah, not bad.
Not bad, yeah. So Logan is a delightful chap. He has a form of epilepsy called temporal lobe epilepsy. Tegretol is a very useful medication for epilepsy, but can cause mouth ulcers.
Have you got your big R voice on?
Is big what?
Ah.
Oh, very good. Excellent. You certainly have. You're ready. Is that where you're
Well, I only sort of feel it here.
But do you feel it out in your skin, or do you feel it in the inside of your mouth?
Only in the inside
In the
of my
inside.
mouth.
Oh, okay, so open your mouth wide. That's right. Really good. Stick your tongue out. That's right. Yeah. Is it that side that's sore? Yeah, very good. And say, oh, again. Fantastic.
Oh.
The number of children who, they'll open their mouths, etc., but they won't say that, oh, nice and loud. You know, you could hear that down Slough High Street.
No, you couldn't hear that.
No, that was just a joke. That's good. Just want to look at the inside of your mouth. Well done. Bring your tongue back in, Logan. Yeah, that's good. So just point to me where it's sore with your finger.
What, the jaw?
Yeah, just
the
yeah.
jaw. Where do
Oh, it's the jaw there, right? Okay, yeah. Good. Well done. So I think that, and this is just a viral ulcer.
Yeah.
And I think that it will go after a few days.
Okay.
It's not connected with his treatment. It's not that
Right.
kind.
Okay.
The kind of mouth, we call stomatitis, inflammation of the mouth, with this medication is very clear, is very distinct, causing mouth ulcers.
Yeah.
And sometimes it can be really severe, blisters around your lips and so on. And that's not what he has, but it's the right thing to do to come in. So this is just a virus in his mouth. I'm going to give him something as a mouthwash to
Right.
use and just swill it around, spit it out. Don't swallow it.
You know how to use a mouthwash, don't you?
Oh, yeah. Put it in mouth.
Swish it round. You don't
Yeah.
swallow it.
Mm-hmm.
That's it. Well done.
That's it.
It's just like bubble gum. You never ever swallow bubble gum.
That's right. Do you know what part of the body that is, Logan?
The spine.
Good. Well done.
I can tell by these bits here.
Yeah, that's right. They are, absolutely.
Those bumpy bits that you can
Those-
feel in your back are exactly these.
They are exactly those. That's really good. You know, there's an awful lot of grown-ups who don't know that.
Ah, I see.
So you're doing really well. Logan, nice to see you. Well done. And hopefully these ulcers will clear up. I'm sure they will with this mouthwash. All the best. Bye.
Bye.
Bye now.
See ya.
I really need.
Alan Brown. Come on in. Have a seat down there.
All right, mate, you're all right.
How are you?
Yeah,
I don't
good.
often see you in this capacity. I usually see you in the
No,
corridor, don't I?
Well, I'm not a doctor person, really.
Yeah.
I like going to doctors. I think, was it you saw me before about my hernia?
A long while back, because I was looking through the notes, and it was back in...
Well, because I'm such a coward, I didn't do anything about it.
So that's 2011. So when I did the referral, you didn't go, basically? Okay, right.
But a friend of mine died from MRSA,
Yeah.
and although things have changed, I know they've changed, but...
It sticks in the mind.
It's what you do.
Okay. So what's changed?
It has got much bigger, but what's prompted me, I went to a funeral the other week, and a friend of mine has just had both sides done.
Okay. Can I have a look at it again?
Of course, yeah.
A hernia is a protrusion of an organ through its containing cavity. The type of hernia that Alan had is an inguinal hernia, which is where you get bowel contents protruding through a muscle defect in the lower part of the abdominal wall. Was it extending down that far last time I saw you?
It was going that way, but it wasn't. I don't think it was as low. But it's got quite big. And I'll be honest with you. What's quite embarrassing is that in the trousers and shorts, other people are noticing it. And see, laying down, it's not as big.
Can I get you to stand up as well, if that's
Of
all right?
course.
Yeah, it's more obvious up here then, isn't it?
Yeah. And it's noticeable when I'm dressed, you know.
There you get changed. The pros of treating a hernia is that you can avoid the complications that can happen in the future. So in other words, strangulation being the one we worry about the most. The cons of treating a hernia include any of the risks of having surgery. So, for example, infection or bleeding or anaesthetic risks. Specifically for hernias, you have something called a mesh repair, and sometimes that can fail, and then you can end up needing repeated episodes of surgery. I think you need to have it done, to be honest. So I'm going to do that referral.
The good thing is I don't get any pain.
Yes.
I've never had any pain or anything like that.
Yeah.
It's just there, and it's just not nice.
Yeah, it's getting bigger, isn't it? And
Yeah. So, you know, when you're on holiday and things in shorts and...
Yeah.
It's just not, you know, it's a bit embarrassing, really.
But can you get it back in all the way? Because I could partially reduce it.
I can get it all back.
Yeah.
But the moment that you let go of it...
It comes back out.
It comes back.
The good thing is that you can put it back in. That reduces the risk of it becoming an urgent problem. But, yeah, if it starts getting stuck or it starts turning purple or the pain starts getting really bad, then you need to come and let us know, like, as an urgent issue.
Excellent.
Good. Nice
Well
to see you.
done. Thank you.
Take care. See you. Bye.
Come through. Okay. Have a seat. Okay, so we met before a month ago.
Yeah.
How have you been since I saw you?
Oh, I've still got this thing. It don't look like it's getting any better at all.
No. I remember you showed me last time this darker area of skin. I gave you something called dermal cream. It works for certain patients, and it's very hard to predict with some of the moisturisers, but I think with this condition you've got, at the same time, some other things came up. We were talking about your blood test previously, about your liver, and I noticed you then came and saw another colleague of mine who talked to you about some of the results that you had. So,
last week, wasn't it?
Yeah.
It's pretty scary.
Yeah, the liver has to be checked.
Well, we've got
have you had
21st, we're going for a scan.
Okay.
I'm not too sure what it's being scanned for. It's still, I mean, there's lots of words being thrown around, but no one's saying anything that really is definitive about anything. And with Stephen's other issues, I need to be a bit more definitive about what we're actually looking for and looking at, because it is causing problems in other areas of the worry of this, that, or lots of words being bandied about.
Mr. McDonald, one of his main diagnoses is related to type 2 diabetes. He has had some suspicion of rheumatological problems. In addition to that, the reason I saw him was because of a skin rash that he had developed on his leg, which hadn't been clearing away with conventional treatments that my colleagues had tried. What do you understand so far?
All we've heard is autoimmune, we've heard possible, like maybe some form of cancer, we've heard all kinds of crazy stuff going on, and it's just not, you know, I'd rather they say nothing and just let us go do what we have to do. But if there is something that's leaning in one way or the other, I'd rather he know about it now, because it is causing problems in other areas.
Hello.
There you go. I wonder if I can make an appointment for somebody to have a look at my finger.
Oh, what did you scratch it on?
Well, it's just that little scratch there.
Does it hurt?
It's hot and itchy.
All right.
And does any pus or anything come out?
It just feels like a big pea.
Yeah.
It's too tender to sort of...
Yeah, to squeeze anything out.
I do suffer from leg ulcers and...
Your legs are a bit swollen, aren't they?
Yeah, well, I've been at work since 6 o'clock, so...
Have you?
for you.
It doesn't look very typical of eczema, and it doesn't look like a fungal infection at the moment. I think it'd be worth taking a skin swab and sending it off to the lab.
The backs of the thighs were weeping. Driving to work, by the time I got there, my seat was soaking.
There's a bit of a jigsaw puzzle here, and we're trying to piece things together. At this stage, we have an idea that your liver enzymes aren't entirely normal, but that's been the case for some time. It might be that in the past it was thought to be due to your medications that were given. You are on quite a few that do involve the liver to help process the medications, so that could be a reason on its own. But until we exclude the other things, we can't just jump to that conclusion.
Right.
Now, what's also complicating this is this thing you've shown me on your leg. When you have bloods like that, we need to make sure you don't have like a rheumatological condition, which can lead to these sort of things where you get skin changes, sometimes you get liver changes. Do you get joint aches?
He has arthritis.
Yeah.
I suffer from
Rheumatoid arthritis. Given that it's not open now, so if you just have a look one more time, and it's relatively dry, I think last time I saw it, it was a little bit more wet feeling. I think it would be reasonable, we could give you a stronger, a sort of steroid cream stronger than what you have with Lotriderm, but it's just purely a steroid cream. What I would suggest is you can continue using that for the next four weeks. But if it starts to become very weeping and hot and red in that area, then you would discontinue it, and you might need to see a doctor sooner in case there's a risk of infection, cellulitis. But otherwise, you can continue.
All right.
And in the meantime, the liver test should come back, and then we can touch base if you feel you're not sure where things are going. But I am going to refer you to rheumatology today.
Okay.
All right?
All right, then. Thanks, Doctor.
Okay. Take care.
All right, you take care. Thank you.
I love you.
Love you too.
Michael Murphy, please.
That's us. Thank you.
Come on, Murphy.
Hi, come on in. Hi, you're right.
I think we've seen you before.
Yeah?
Yes, we have.
Okay. I've definitely seen you before. Yeah. Yeah. How are things?
Not all too great.
He's getting there. He is getting there.
Yeah, I am getting there, but still, it's kind of hard to.
Still needs his pills.
And how are things otherwise with your mood, with your general mental health? How are things otherwise?
Yeah, things good. I mean, I've had a few little hiccups, haven't I?
Yeah, but it's nothing major, nothing that you'd be worried that he's deteriorating.
Yeah. So Michael had seen me in the past for problems regarding his mental health, mainly regarding his difficulties with his anger management.
His mental health, since coming out of hospital, has hit a major high for him. It's his attitude towards people.
Yeah.
I've tested him a few times. I've
Yeah.
rung him up, pretending to be someone else,
Okay.
saying that he's going to get in trouble
Yeah.
at work, and
Yeah.
he's like taking it on the shoulder, and he's like, "Okay, that's fine." He goes out. I'll come
Whereas
to the
something
office.
that would normally have got you quite
That
agitated.
would've-
Yeah.
He would have been down the
Yeah.
phone, and he's not. So I'm really
Okay.
proud of him for that.
Good. So those things are improving.
Yeah, all together, I haven't felt like the urges of punching and all that kind of like stopped and stuff like that, you know.
Yeah.
Like, so I've kind of stopped all that kind of thing.
Okay. It's a bit more chilled out.
Yeah, a lot more chilled out.
Yeah.
So I haven't got so much incredible
Sort of anger.
mini Hulk going on inside
Yeah.
me, you know.
Yeah.
So
Yeah.
it's all cool.
Okay, good. So on this occasion, he'd come to see me because there were ongoing difficulties with gaining and maintaining erections, otherwise known as erectile dysfunction. And we'd agreed to trial some medications to help him with this problem. You can see you've been having the pills for a while, haven't you now? How long? have you been taking them for?
2 months. Yeah.
About 2 months. Okay. What do you think? I mean, and welcome to chip in as well. I mean, what do you think kind of was the main thing contributing to it?
His exercise, lack of exercise. That's what I think, because since you've been running, he's... I see an improvement. I see a massive improvement.
Mm-hmm. Okay.
I don't think he does.
No, I still don't feel as confident in certain things, you know.
Erectile dysfunction is very commonly associated with mental health conditions and can sometimes also be made worse by certain medications as well. In Michael's case, given that he had quite a significant background of mental health problems, particularly with regards to his mood, it was quite clear that this was probably the causative factor for his symptoms. But listen, there's a lot of positive things that your partner's saying here.
Yeah, I know.
Yeah.
Definitely know. It's just
There's a lot of good things that she's mentioned today that you should be proud of, from what it sounds like.
I should. But
Yeah.
it's
Maybe it's about getting that self-confidence back, actually.
That's probably.
Because what I'm hearing is actually that maybe a year ago you were someone who may have flown off the handle quite easily and you had a lot going on.
Yeah.
And you seem to have turned the corner a bit.
The thing is, we've just got engaged, so it's like...
Oh, fantastic. Congratulations.
Thank you.
Thank you. High five.
He always wants to high-five someone. I see loads of improvement with him. So it's like, if you can see that from a year ago you've come this far...
Yeah.
Yeah, that's true.
I think you've done amazing.
I
I don't think you need
That's a lesson you have to learn. Always listen to the lady.
Yeah.
She's always right. Yeah.
I don't think he needs...
I think as far as that's concerned, I think you need to maybe just look at what's going right. Okay, look at the things that are positive, and focus on those things, and you'll find actually that the other things might follow, and that you eventually might be able to get the confidence and maybe come off these pills. You know, because I think like I said at the beginning that this is probably psychological. Almost 99% this is psychological. That it's your brain that's stopping the lower half from working as it used to.
Yeah.
Yeah. All right.
Okay, that's brilliant.
Brilliant.
Thank you very much.
Remember, golden rule, always listen to your heart.
Of course, man. Have a nice day.
All right, take care. All right, see you later.
Oh, sorry.